we are all ready to go. And Dr. Yusuf Sheikh, the president.
Thank you, Tahir Saab. Appreciate. Thank you, everyone, for coming today. We are in the midst of unfortunate pandemic. A lot of people have died, but we are fortunate also at the same time that we have the vaccines. One thing which is a very common issue in the US, we have seen it again in the immigrant population is the vaccine hesitancy. A lot of people have questions, concerns. This time we have new vaccines which have new technology. We never had mRNA vaccines before, so a lot of people have concerns. We wanted to do this public service webinar to help educate. We all have been vaccinated ourselves. A lot of physicians in the audience have been vaccinated, and we wanted to continue vaccine. Only physician getting vaccinated will not solve the problem. So considering those factors, we wanted to do this public service webinar. I would like to ask Mr. Siraj Khan, who's the president of the Pakistani Student Greater Boston, who has supported us with this webinar. So, Siraj Saab, you want to say a few words to the panelists in the audience, please?
Thank you, Dr. Yusuf. I find it amazing that just a few months ago, we were praying for the vaccine to come, and with just one shot from it would save our life from this pandemic. And yet here we are, close and yet so far. It's not just the physical part of it, the availability, where and when we will get it, how we will get it, but are we really ready and comfortable with it mentally when our turn comes? We have now more questions than answers, all at a time when many of us have lost many loved ones. In my own family, there have been several, one only last week. As president of PAGB, I'm pleased to be here supporting APPNE in this social impact initiative. And I'm grateful to all the panelists who have taken time out of their regular working schedule on a weekday too to be present here with us today to hopefully get you into the comfort zone. Thank you, everyone.
Thank you very much, Siraj Saab. So I will introduce our panelists, and then we go from there. So our first panelist is Dr. Richard Ellison, our colleague at the UMass. Dr. Ellison is the professor of medicine, microbiology, and physiological systems at the University of Massachusetts Medical School, and is the hospital epidemiologist at the UMass Memorial Medical Center. Dr. Ellison received his medical degree in 1977, the time I was born, a long time ago. Hahnemann Medical College in Philadelphia, and completed his residency training in internal medicine at the Rhode Island Hospital and fellowship in infectious disease at the University of Colorado in Denver. He is a board certified in internal medicine and infectious disease. Following his fellowship, Dr. Ellison joined the faculty in the Department of Medicine at the University of Colorado in 1984, and then he came to the UMass in 1991. Dr. Ellison has written more than 55 peer-reviewed reports along with 41 invited papers and book chapters. Since 1998, he has served as an editor general Watch Infectious Disease. He served as the president of the Massachusetts Infectious Disease Society from 1998 to 2001. Dr. Ellison has served on numerous internal hospital and medical school committees, including those related to pharmacy, critical care, safety and risk management, biosafety, emergency management, infection control, as well as resident selection, graduate medical education. He's also served on the advisory committee for the Massachusetts Department of Public Health. Our second panelist is Dr. Matilde Castiel. And Dr. Castiel is the Commissioner of Health and Human Services, City of Worcester. She was appointed the Commissioner of Health and Human Services in September of 2015. She oversees the Division of Public Health, Youth Services, Human Rights and Disabilities, Veterans Affairs and Elder Affairs, and homelessness, along with the advancing important new initiatives that fall under the scope of homelessness, mental health, and current opiate crisis. Dr. Castiel has worked in the Worcester community for over 32 years, including UMass Memorial Medical Center and Family Health Center of Worcester, also as an associate professor of internal medicine, family medicine, and psychiatry at UMass Medical School. In 2009, Dr. Castiel founded the Latin American Health Alliance, a non-profit organization in Worcester dedicated to combating homelessness and drug addiction. The Latin American Health Alliance programs consist of the Hector Reyes House, Casa Reyes, a substance abuse treatment facility, and transitional house for the Hispanic males. In 2015, she opened the Cafe Reyes on the Shrewsbury Street in the Worcester, an innovative job training program for the residents in the Hector Hayes House and Casa Reyes. At present, she continues to serve as medical director and sees patients there once a week. Our third panelist is Dr. Fozia Qamar, again our colleague at the UMass. Dr. Qamar is an assistant professor of medicine at University of Massachusetts Medical School. She's also double board certified in internal medicine, infectious disease, and today she will be talking to us about the mRNA vaccines that we have in the US. Our last panelist is John Rocchio, and John is as a member of the Massachusetts Vaccination Advisory Group, tasked with helping inform and advise on the safe and equitable distribution and administration of effective COVID-19 vaccines to the residents of Massachusetts. Concurrently, John is a member of the CVS, the Pharmacy Chain CVS Health Regulatory Affairs Program. Affairs team, he is the incorporated which is incorporated with the comprehensive working group tasked with planning CVS health role in aiding in the safe, efficient, and equitable distribution and administration of the COVID-19 vaccines. Thank you very much for coming today. We do have, as I mentioned, some other physicians from New Hampshire and Rhode Island. We also have other, from the other states, and who also can answer any question if people have a specific those states like Rhode Island and in the New Hampshire rollout. But our primary panelists are from Massachusetts. Welcome, Dr. Ellison. You can go now.
Yes, thank you, Yusuf. I really appreciate the opportunity to speak to all of you. Let me just give this introductory comments and sort of talk about what's going on with vaccines, because we're in a period of time which is, we've never developed vaccines ever this fast in the history of the world. We went from discovering a virus back last January to now having, within less than one calendar year, of developing multiple vaccines, testing them in humans, showing they're safe, and giving them to individuals. There is some confusion, though, I think, because people are hearing about so many different vaccines. So I would just make a couple of very quick comments and say, what the heck is a vaccine, and how do they work, and then why can we have multiple different ones? So basically, one step back, and the simple thing to do is that viruses are very, the simplest kind of life form that exists. It's basically a bunch of proteins, a little bit of RNA, and a little bit of a lipids to package everything, to hold it all together into an envelope. It goes and gets into our body. It goes and then it attacks one of our cells, invades our cells, and takes over the machinery of the cell. And it takes 2 copies of its RNA, and then tells to take that cell and uses all the standard machinery in that cell to make proteins and make little baby viruses, which then break out of that cell and infect other cells. And one infected cell can make 1 million, 2 million different viral particles. These particles all have a component on them. In general, they all have proteins on the surface. And those proteins allow the virus to go and attach to a cell, get inside the cell, and do the whole process of infecting it. So it's inside our body, in the serum or inside the nose, where our body can attack it by generating antibodies, which will bind to proteins and usually prevent the virus from entering a cell. And we have other ways we can teach our body's immune system to kill cells which are manufacturing a virus. So once a cell is infected and begins to make baby viruses, our body can use special other cells to kill that cell before it makes millions of copies of the viruses. So the key things, the components of that are proteins. And all of our traditional vaccines in the past, the tetanus vaccine that everyone's gotten, the measles, mumps vaccines, are all developing antibodies which target proteins which are part of the viruses. So what we have down now with all the different kinds of vaccines which are being developed they all are producing viral proteins. And they can do it a couple different ways. The 2 vaccines we have right now, the first 2, Moderna and Pfizer, are mRNA. And mRNA is a molecule that's present inside our cells, which are the last step in manufacturing a protein. So what is done with this is they inject this very special mRNA in a way, and it's encapsulated with what we call some lipids, which allow that particle of the mRNA to get into our cells, and our cells manufacture a protein for the virus. And our body then develops antibodies to that viral protein. It's called the spike protein. And anyone who's seen a picture of the coronavirus, you've got all those little spikes. Looks like a round ball with spikes on it. And so the antibodies are targeting those spikes. The second group of vaccines that are just about to come out is Johnson & Johnson. We hope it's going to be approved by the FDA next week, and hopefully it will be available to give to individuals sometime in March. That one actually takes is a approach of taking another virus, which in taking out parts of that virus and inserting the gene for the spike protein. So that little virus, which cannot grow in human cells, will go infect a cell, will get inside a cell, manufacture the spike protein, and our body makes antibodies to that. There's going to be yet a third group of vaccines in the future, which are now being studied, where people have purified the spike protein, and they'll be injecting the spike protein into someone's body and then making antibodies that way. That's very much like the tetanus vaccine that we all have gotten. The reason we got the mRNA ones out first was because they are very quick to manufacture. So they were able to manufacture that one really in weeks and start doing studies within weeks of getting things started. The second group, the Johnson & Johnson vaccine, and there's another one called AstraZeneca, which have this, it's an adenovirus vector, take a little bit longer to manufacture. So that's why they have come in second. The hardest one to manufacture is a purified protein, and that's why they're going to be probably the third group of vaccines which come out. But that's where we stand right now, and why there's so many different kinds of vaccines. They're all doing basically the same thing, but they're just getting this, the spike protein into our body in different ways. So let me stop and we can talk about this in much more detail later on.
Thank you, Dr. Ellison. Fozia, you want to go now?
Sure. Assalamu alaikum and good evening, everyone. First of all, I would like to thank Dr. Yusuf Sheikh and Mr. Tahir Ali for organizing this important community service event. I really appreciate your efforts and the efforts of Association of Pakistani Physicians of New England. It was only 11 months ago that I was invited for a similar Zoom conference to discuss this new pandemic and what it pertains for all of us. And it is such a pleasure today to discuss the wonders of science. In mere 11 months, we're here discussing prevention with not one, but two very effective and safe vaccines, and several more in the pipeline. Dr. Sheikh had requested me to speak about the most common questions that I've been asked regarding the vaccines. And I think the most common question which comes up and which is the leading cause of vaccine hesitancy is about food allergies and its side effects. And I constantly been asked again and again about this same question. In terms of allergies, there have been several cases which have grasped media's attention of patients having allergic reactions to Pfizer or Moderna vaccine. Severe allergic reactions to any vaccine are quite possible, but they are usually very rare. And I think at this time, it seems like a hyped up response, mainly because of this mass vaccination effort which is going on. This vaccine is reactogenic, meaning a majority of people get local side effects or just like feeling crammy for a day or two. And it can be slightly worse after the second shot. But that's really it. It's not yet clear about the allergic reactions. Like I get asked this question that I have an allergy to shrimps or I'm allergic to something else. Should I not get this vaccine? It's not yet clear what has caused most of the allergic reactions. However, one additional ingredient which has been found in these mRNA vaccines is the polyethylene glycol. This material has many uses in the medical industry. Most commonly, it is used as a laxative. People who are known to be allergic to polyethylene glycol should not receive the vaccine. Patient with allergies to food such as shrimps, or allergies to latex, insect stings, or inhalant allergens are not thought to be at increased risk of an allergy to this vaccine. Another question which comes up is pregnancy and mRNA vaccines. To answer this question, really, we need to first discuss what is the risk of a pregnant woman when she gets COVID-19. And we know thus far that pregnant females tend to be at a higher risk of hospitalization, requirement of oxygen, and getting much more sicker than their other female counterparts. The trial researchers deliberately did not include pregnant females in the trial. However, 18 females who got the vaccine inadvertently actually got pregnant during the trial. The researchers will update us later about the pregnancy outcomes. The other question which a pregnant woman needs to think is, you may also wonder about the risk to the fetus if a person gets COVID-19. Research so far suggests that having COVID-19 might increase the risk for premature birth, particularly for those with severe illness. At this time, the CDC, the American Society of OBGYN, and Society for Maternal Fetal Medicine agree that the new mRNA COVID-19 vaccines should be offered to pregnant and even breastfeeding individuals who are eligible for vaccination. However, WHO recommends against using mRNA vaccine in pregnant women. And the reason only is, as I said, that because the women were not included in the trials. However, scientists and researchers do believe, because of the mechanism and because of the way these vaccines work, that the risk is very, very low. The mRNA vaccines, they do not contain the virus particles. As Dr. Ellison explained, that these are just like proteins, and they actually do not have the actual virus in there. Within hours or days, our body is just going to eliminate the mRNA particle used in this vaccine. So these particles are unlikely to reach or cross the placenta. And the benefit is that the immunity that a pregnant individual generates from the vaccination, those antibodies can actually cross the placenta and keep the baby safe after birth. So options for pregnant females are to they can get vaccinated as soon as the vaccine is or you may choose this option if your risk of getting COVID-19 is high, like if a person is a healthcare worker or is an essential worker. B, a person you can wait if you're pregnant, and you may want to wait and choose some other vaccine which is in the pipeline, a more traditional kind of a vaccine. Or if your risk of getting COVID-19 is not very high, you may try to control your exposure risk. And there are many, many questions, and I can certainly answer that as the evening will go on. I will stop here, and we will probably come back for more questions.
Thank you, Dr. Qamar. John, do you want to go ahead and tell us about the CVS, how the CVS is going to implement the vaccination drive in the state, in the whole country, I believe?
Absolutely, Dr. Sheikh, and thank you for the intro, and thank you for attending, and thank you to the panel for taking the time out. It's truly good to get this message out and be able to assist, as the vaccination phase is the most important part of our journey that we've been on in this horrific time that we've had to go through with all the loss and the aforementioned suffering that we've seen. And this vaccine, although not a panacea, not something that's going to completely eliminate any concern, is certainly an essential step that we must take to try to eradicate this particular pathogen and get us to a better place. So from a CVS perspective, you all may have seen plenty of times in the press that we were in the beginning phases vaccinating long-term care patients, and we're more than halfway through that. As we know, the 2 doses complicate the logistics and require extensive planning on getting to that patient population. But now that we're entering into phase 2 and moving through that long-term care phase, we're excited to continue to help the community. And in Massachusetts, CVS in particular has been up and running with 8 locations for the last couple of weeks, and that's only going to increase now. If we had held this last week, we'd probably have less information, but as you are all aware in the federal program, that they're going to be sending more vaccinations our way to the tune of 21,000 per week coming from the CVS network and through our pharmacies. So what's going to happen is many folks are going to be wondering, how do they get involved with that? And I know that Dr. Castiel will probably have some information specific to Worcester County. However, the state of Massachusetts rollout and map that shows the active locations will be updated with all new locations that are added. And I encourage all of those that are within the phases to study the phases, understand when their turn is, and to look into the state webpage, go through the map links. And when you're selecting a CVS pharmacy in that map, you'll see it takes you through the CVS portal. And that's where it's asking you all the screening questions to make sure that you are within the phase of the rollout that we're in now. And we'll schedule you for an appointment when available. The key there is when available. We know the demand is high. We understand that beyond healthcare workers and emergency workers at this time, COVID-facing folks and those facing patients on a daily basis, we're entering into the 75+ phase. So you want to be sure that if you have family members that are in the affected age range that are able to be vaccinated and they are not as technically sound, please help them out with managing this enrollment. Do not have folks show up at any pharmacies, as we wouldn't be able to handle the walk-in capacity because of the screening questions, because of the phase rollouts. It needs to be organized and through the online portals, cvs.com or the CVS app, or like I said, leverage the state page, because not only are you seeing the CVS locations, but you're seeing all the other pharmacies that are participating, and you also see the state vaccination sites. So it's key to keep pressing at it if you're in that age range and you're in the phase rollout range, to continue to monitor that web page. From a CVS specific standpoint, we have built our system to be able to automatically schedule both doses, regardless of which vaccine you'll be receiving. And certainly when we get into the other vaccines that may only require a single dose, that'll certainly be incorporated as well. So don't be discouraged by the difficulty in the early phases. The demand is high, but every week we will be receiving more vaccine, more appointments will open up, and we're here to assist.
Thank you, John. We will probably ask you a couple of more questions. Dr. Castiel, you want to go ahead now?
Yeah. Thank you, Yusuf, for inviting me. I think it's probably all cities in Massachusetts. Everybody is sort of scrambling during this time, trying to figure out how to roll this out. The state, the CDC put out a way to roll this out. And Massachusetts in particular, our state has looked at it and wanted to put it out through an equitable fashion, meaning that we want to get vaccines into vulnerable communities, into communities of color, and make sure immigrant community, and make sure that everybody is getting the vaccine. So as most of you know, we're, as John said, we are now in phase 2. Who we vaccinated in phase 1 was obviously all the physicians and all the doctors, but at the same time, we vaccinated everyone who was the person who was walking into the room bringing food, or the person who was cleaning the room of somebody who was COVID positive. So trying to get everybody in the health who are in the hospitals who are COVID facing. We then, as he talked about, John talked about, we went into the long-term care facilities, the group homes, all of those, because people are unable to isolate. And so those areas where people, they're sharing a bathroom, they're sharing a kitchen, they're unable to isolate. That was the next group that we went to. We also then did all the first responders, whether they're ambulance drivers, police, fire. We again, front-facing people. And then we did the jails, and we've done the shelters. And a lot of people say, why the shelters? Again, for the same thing, or the jails unable to isolate. And those were the criteria for that. And then we did the health workers that were not COVID facing. So the dentists, the psychologists, all of those, dental hygienists, all of those social workers were part of that. We are now into phase 2, where we're looking at, and that has changed a couple of different times. We are now looking at individuals who are 75 and above and really trying to get our community, all the different entities that deal with 75-year-olds, whether it's elder services, the senior center, the council on aging, to help us gather all of those folks and try to register. We are registering them through our through the city. We are doing through our health department, being able to vaccinate. The hospitals are doing the same, calling their patients. They ask you to go through, for example, if there is a My Chart, to actually have that communication with your doctor so that they can give you an appointment to be able to register. We also today just opened up a mass vaccination site here in Worcester. It will be at Worcester State, and again, it's open to everybody in Worcester, but also open to everybody in Massachusetts. After that, we are doing individuals that are 65 and over, who have 2 comorbid conditions. There is a list of those comorbid conditions, those medical problems that are considered. So having 2 of those are the people who will be going next. And then for us at the city, we are also going to be vaccinating all the housing, the elderly housing sites. So Worcester Housing, for example, just as we did the shelters in a mobile way, going to those places. We're looking also to figure out who is homebound and who lives in some of these other affordable type of housing for seniors. After that, we're looking at sort of the education, all the frontline working people who work, for example, in the groceries, people who drive buses, the K-12 teachers. That's a lot of the folks that we are going to do, meat packers, anybody who works in transportation. So there is a whole list of folks that we go through on the phase 2 that we're going to go. But right now, as we were talking about, we're in phase 2, step 1, when we're looking at the 75-year-old. So I think our overall goal is that everyone, whether it's the hospitals, whether it's our health department, whether it's our mass vaccination sites, whether it's CVS, whether it's Walgreens, and all of that is open to us here in Worcester, and also going on the mass website and being able to click any one of the, there's a map there, and you click any one of the sites there that tells you, for example, Gillette is open or Worcester is open, and try to get one of those sites. Hopefully there will also be a mass call line. We have one here that's just starting in Worcester, but we will also have a Massachusetts call line, which will also assist elderly to be able to register. Thank you.
Thank you very much, Dr. Thank you very much. So we can start the question answer. It's perfect timing, 7:04. So we have enough time to ask a question from the panel. Let's see. The chat has a couple of questions I saw, so I can ask from them, and then a couple of questions I have on my paper. So there's a question is, what expected treatment for side effects resulting from the COVID vaccine? Who pays for it? So I think it's a
As Dr. Qamar said, the main side effects we're seeing from the vaccine in generally are, first, a local reaction where people typically have a sore arm. It's more for those who've old enough to have gotten the shingles vaccine. It's more like that. It's not quite, a little more than you get with the flu shot, but so when I got it, I was uncomfortable rolling over for the first night. About 10% of people can develop a fever with this, and that can be treated with ibuprofen or aspirin or Tylenol. A few people get diarrhea, but it's very self-limited. Almost all of the side effects for the majority of individuals will show up within the first 24 hours. And if you can make it through the first 2 days, you're generally going to feel fine. Very rarely we're seeing a few more local reactions showing up at about a week, but they are also we call them self-limited. They're going to go away by themselves, and using just over-the-counter non-steroidal anti-inflammatory drugs, ibuprofen, Tylenol, aspirin, or usually handle that. The vaccine, the vaccine itself is free. Cost for getting if you do need to get aspirin or non-steroidals, that's something you'll need to cover for yourself. Although you have a kind of medical plan, you could certainly submit that for, say, a medical expense to get reimbursed that way.
I was thinking of the same lines. You know, there is a vaccine injury fund, which I think is primarily for flu vaccine. So I'm not sure that fund will cover any injury somebody develops from this vaccines. Do you know?
Yeah, and it is expected. All the vaccines have very rare complications. Right now, the risk of having anaphylaxis is about 10 in a million, or about 1 in 100,000 with the Moderna vaccine, and about 2.2 in a million for the Pfizer vaccine. That would require there is a vaccine adverse effects reporting system. You can do that. And actually, when you go and get the vaccine, the CDC is tracking vaccine side effects, and they're encouraging anyone to sign up for VSafe. I did it myself, and you get questions. Do this to actually remind you about the time you're getting your second dose of the vaccine. So encouraging people to sign up for that. And that's where we're going to get more information about the risk of side effects from the vaccines.
Very good. The next question is from efficiency, efficacy, I would say, perspective. Out of three, which one have a better and longer efficacy? Dr.
Fozia, you want to sort of trade off? We can answer that one.
Sure. So efficacy-wise, both of the mRNA vaccines are scientifically, if you use the words efficacy, they are very, very effective, like 94 or 95%. However, the data for the other vaccines which are coming up, like Johnson & Johnson, is also quite effective. Even if you see the number 70%, that does not really mean that it's not effective, because really researchers, when they are looking for decrease in hospitalizations, they are looking for decrease in deaths, and really these vaccines were found to be extremely effective. Usually flu vaccine is like around 40 to 60% effective, and we call that as an effective vaccine. So if the question is efficacy wise, I would say all of them are very effective.
Okay. Along the same lines, there was a question from the audience that if we have mRNA vaccine, which is effective, then why we are developing other type of vaccines?
Well, two things about it I could say. First, we didn't know which vaccine was how good any of these vaccines are going to be. So in the middle of the summer, it was really important to try and find one that was going to work. We didn't know that we're going to have 4 or 5 that were going to be effective. So effort was put into that. But the reason, one of the other main reasons for getting something along with the mRNA vaccines is the mRNA is a brand new technology. It's usually something was done more almost at an academic level, and it's manufactured in a completely different fashion than the other vaccines. And so there we're really geared up to make 10,000, 20,000 doses initially. It's been phenomenal. They're going to be able to make 20 million doses in a year. The other vaccines, which are coming out of Johnson & Johnson, is using a very established technology, as is the one, the Novavax. These are very established ones where the people have already been manufacturing 100 million doses of these. So the manufacturing capacity for these other vaccines is already in place. And so it'll be much easier to make 100 million doses of the Johnson & Johnson vaccine. Also, the mRNA vaccines, they're brand new, and they're a hope in the future the technology better. They don't have to have the ultra cold freezers to do it. The traditional vaccines can be standard in a standard refrigerator. It's much easier for CVS to sort of roll out and give the Johnson & Johnson vaccine than it is going to be for the mRNA vaccines.
There's a question from Yasmin Khan that in general, are patients who have recovered from COVID getting the vaccine? And if so, how effective is it in those patients who have COVID infection and getting the vaccines?
Yes, so if you have had COVID-19 infection, then the chances that you will get reinfection in first 90 days is low. However, it's still present. CDC does recommend that you should get vaccinated even though you have had COVID-19 infection. They do not say any minimum time period between infection and vaccination. That's the recommendation by CDC. But if you have completely recovered and doing okay, if you have not received plasma or monoclonal antibodies, and if there is a chance for you to be vaccinated, it would be a good idea to get vaccinated.
Excellent, thank you. The question comes from Mr. Khalid Sadozai that what different cofactors and adjuvants are used in these 3 different vaccines. I think we briefly discussed, but if Dr. Ellison or Dr. Qamar, you can tell us what cofactors and adjuvants are used.
Actually, just for so an adjuvant is something which is added to a vaccine to make it more potent, to do a better job of making the body make antibodies. And so a number of different compounds have been shown to actually do this. One of them is different kinds of fats or lipids. And the mRNA vaccines do contain some lipids which will serve in that capacity. So the mRNA, the lipids and fats which are part of in the vaccine serve as adjuvants there. For the Johnson & Johnson vaccine, the rest of the virus is something called an adenovirus, which our body has generally seen. And the adenovirus and the rest of the adenovirus serves as a way to sort of boost that vaccine. And the other ones, the protein vaccines, are going to include a number of other kinds of fats are going to be added to at least one of those vaccines to try and use that to help boost the antibodies. So all 3 of them have different kinds of ways to help the body see the spike protein and make larger amounts of antibodies.
The Siraj Khan is asking a question that if you are already COVID positive, but you don't know about it, you are unaware of it, and then you get a shot of the COVID vaccine. So what will happen with that?
I don't think there should be any problem. You mean when there is an active COVID infection?
But you don't have symptoms, it looks like, you
Right. It can happen. I'm sure it can happen. And body is developing antibodies. And if you give the vaccine, and remember, the vaccine is just the mRNA vaccine. It does not have the actual virus. So the body will have an immune response. It will depend, I think, on the person, his underlying problems, underlying medical issues, on how the body will respond. But I don't think we have much data to say on what exactly is going to happen. I mean, it's a theory, which I am probably thinking based upon this technology and how it will happen, but I haven't come across. Probably once we start vaccinating more and more people, we will learn more about it.
Thank you.
It's a little bit of information that's just come out. Traditionally, in the medical literature, we wait until something is peer-reviewed or looked at very carefully and then go into the medical literature. We're happen to be a new era in the internet where many companies or other individuals will post information onto the studies which have not yet gone through peer review. It's called preprint. And so many of the things coming out about these vaccines are in that stage. So there is information coming with this release that if someone who actually has had COVID before, it looks like they may have a very high antibody response. We talk about giving 2 doses to boost it. If you had COVID and then you get the vaccine afterwards, you may be able to get a booster effect. That would be wonderful news. This is a preprint, and we don't know until something is really go through peer review. We really have to question, is that accurate or not? But it would be exciting if that was the case. And that's just really coming out in the last 24 hours.
Someone's Malik Saba is asking, what if you had a COVID and you were treated with the plasma, remdesivir, and other modalities that we were using, And should you still get the vaccine?
You should wait 90 days before
Okay.
getting the vaccine. Yeah.
And then Siraj Saab is asking if there's any delay in the second shot, for Plasma, for the Pfizer 3 weeks and for the Moderna 4 weeks delay. What happens if there's a delay in the second shot?
There shouldn't be an issue. The minimum time period is given so that you don't get it earlier than that. You can get, at least CDC has recommended, like 4 days earlier than your 3 weeks or 4 weeks point. But for the second shot, there's like no maximum period at this time.
I think UK is intentionally delaying second shot on many people.
Yeah.
So the reason there is because they want to utilize and vaccinate more number of people and, use that vaccine as such in that sense.
So I
Well,
think they're-
the other thing about this that comes up is we were trying to develop a vaccine that was going to be protective as fast as possible. Remember, think back where we were in July, we had nothing at all. So you wanted to get a good vaccine which could work. And they designed things to say, can we get to be protective levels as fast as possible? So if you need to give 2 doses, giving them, within 3 or 4 weeks, if you can get a protective level in 3 to 4 weeks, that's wonderful news. Other vaccines, as Fozia said, is actually delaying things and delaying a second dose may actually get higher levels. We give some of the vaccines we give, such as the hepatitis B vaccine, we give 1 dose, a second dose at a month, and then 1 at 6 months to get maximal benefit, by giving the 6-month dose. So if we'd had the luxury of time to say waiting for a second dose till 6 months, that might be better response. But we didn't want to wait. I want to get the most protection I could get in the first month as soon as possible.
There's a question which is very interesting, and I had the same question too. Does someone has a choice to pick which vaccine to take from available choices? Do we have a choice, or we don't?
My choice is to get whichever one I can get.
Get vaccinated, right?
We didn't have the choice in the hospital. We went there. They said you are getting Pfizer today. It was Pfizer today. Next week was Moderna. So yeah, unfortunately, we don't have a choice right now. Probably till the next 6-8 months when we have more vaccines. The question is from Mr. Tahir Ali. Even after we all get vaccinated, hopefully, and the children are not, because none of these vaccines are approved for children at the moment. Can we approach our kids and grandkids and hug them?
So the vaccine is going to prevent you from getting severely sick, right? Just remember, all these vaccines, they do not prevent transmission. So if you're sitting with somebody or hugging somebody who has an infection, so the chances that you can get infection is still present. The work of the vaccine is to prevent you from being hospitalized, prevent you from being on a ventilator. So to answer your question, will you be able to hug? It's a tough call. I mean, Dr. Ellison, what would you say?
Yeah, you're going to be protected yourself. You don't know whether you can give it to someone, whether you can still get the infection and give it to someone else. That's the next thing. Can we prevent you from getting a minor infection and carrying it and giving it to other people? That we don't know about that. And I think it's going to be a while before we're going to have to be cautious for the next 6 months at least.
There's a question for Dr. Castiel that if somebody lives in the Worcester County, now they have you have a lot of centers, the vaccination sites. So when the phase 3 and 4 comes in, will those centers be open? And like, if I want to get vaccinated, if I was not a physician, will I go there and get vaccinated, or if I have to go my PCR?
So there are 3 phases. So the third phase after the second one is open to everybody. So that's when everybody can go. And for Worcester, it will be the mass vaccination site where everybody can go. And we will probably, I assume, still be working on some of the phases if they haven't been finished, and who else is looking at that. But for the whole county, it will be the mass vaccination sites. Worcester, Worcester is trying to take care of Worcester and its surrounding towns that are part of the Department of Public Health, our regional towns. So that's a huge group for us even to take care of. So it will be the mass vaccination site.
Okay. But you are planning to keep those sites open for a long time?
Absolutely.
The city is not going to close them for the time being?
No.
population that you have to cover and vaccinate. Okay.
Correct.
And there's a question from Salman Malik that can we mix and match, like first from for Pfizer and then Moderna, mix and match, just like we buy clothes from Walmart. Can we mix and match here?
I don't think we have any data on that. So at this time, it's not recommended that you mix and match.
Okay. And this question is from Shabana Chaudhary that how long the immunity lasts, like, do we have any data about that?
Short answer is no. There's no one in the world who got the dose of a vaccine before last July. So no one in the world has had the vaccine for more than 7.5 months. There is, hope that some of the vaccines that similar to what they use the same kind of model that the Johnson & Johnson was. There have been other adenovirus-based vaccines where it does seem to be able to induce immunity for 1 to 2 years. So we can really very much hope for that. But the other question we actually are going to have to know about is this virus is going to change. And we already know that there are variants coming up, just like with flu, there are major changes in the virus, the flu virus every year. So you have to give new flu vaccines to make up to come up address the new variants of flu, which have come up since the prior year. So what we have to find out and watch for now is there how much variation will take place with the COVID coronavirus, and will the vaccine protect against the virus which is there next year? And we don't know that yet.
So we don't know if the vaccine will work for all the variants at the moment in time, unfortunately.
We don't know that, and we also don't know that there'll be new variants next year because this virus is spreading around the world. There's, with millions of people getting it, there's a real chance that there will be new variants will continue to emerge. And we do think that they're going to have partial protection, so that one of the things which was so terrible this year was that no one in the world had any antibodies to protect against this. Now we're going to have partial protection from getting the first, getting a vaccine this year, and that will hopefully provide protection against terrible infections next year. But we don't know whether it will completely protect us.
Thank you. There's a question for John that, and John, you serve on the governor's COVID vaccination advisory council committee. So what is state the rollout in the Massachusetts, from the pharmaceuticals like the CVS and Walgreens? How the rollout is coming from the state?
Sure, I can speak. With the advisory, we were working on the equitable distribution, as was stated earlier. We weren't selecting how it was going to be rolled out. It was who was going to go and the prioritization, working through that. However, from my work experience, I can understand working with the state and seeing how the state is rolling it out, that the state is working hand in hand with pharmacies of all major chains, independent pharmacies, and other able vaccinators that they can set up clinics, various locations. And so the state has been working with CVS. They were facilitating the federal allotment of the vaccine in the initial phases. And now that they've gone into in-pharmacy availability, the state has been giving us a supply for our 8 essentially pilot locations in the state, so we can get used to the process of having patients come into our pharmacies. And now we're going to see that expanded through the federal allotment that's coming down, that just got announced a couple days ago. So the state is working hand in hand, actively increasing the amount of sites. So you'll see that in the amount of vaccine more and more available. The state is working with us in increasing the amount of sites, and that's all pharmacy locations. You're going to see that continue to increase. So we're happy about that. And, at capacity, we're looking at, in some instances, based on the location, the amount of vaccinators at that location, anywhere from 140 to 200 doses per day at each site. So you can see as that expands, we're looking at, thousands and thousands of more vaccines being administered each week. So we're going to see an exponential growth, and hopefully that supply chain keeps on going, and we get everyone to where we need to be.
John,
Yusuf, I want to add, if I could, just an addendum to what John just said, is that not only are the pharmacies going to be doing, but also looking at the supermarkets to be, so any place where you can access, as we're talking more into the later phase, If you can access the, markets, or you can access the pharmacies, those are going to be open for people to go in and get vaccinations along with the mass vaccination site.
And I have the question on the same lines. We understand the vaccines are free, but if somebody goes to CVS, do they need to have insurance? I mean, is there any administrative cost of vaccination?
There's an administrative fee that's covered by all the insurers out there. And if there is somebody that doesn't have insurance and nothing to bill, there is an avenue there. There will be no charge to the patient. So don't think that cost is anything prohibitive for this.
Okay, so people should not be discouraged if they have limited insurance or no insurance. They are in the middle of insurance. A lot of people have lost their jobs during this pandemic, unfortunately.
Right,
So
right. Yeah, there'll be no issue receiving it at no charge.
even from the CVS.
Correct.
The question is coming from Shabana Chaudhary that as healthcare providers, should we go for antibody test? When and how often should we do that? I think Dr. Ellison can answer.
It's really not, really, it's not necessary to do antibody tests. There's not any reason to do that. Also, I'll mention that people are going on their own to getting antibody tests. And some of the tests which are on the market to do that actually do not go for the spike antibodies to the spike protein. There are several other proteins in the coronavirus, and some of the companies which are selling antibody tests do it against some of the other proteins in the virus. So that I've heard is where people are getting tested and they come back and say they have no antibodies, and that's because they were looking for another antibody looking for another protein in the virus. So people actually can be given false information that they had no benefit from getting the vaccine. But I would not recommend routinely getting the antibody test.
Okay. And Dr. Ellison, are you seeing these new variants in our UMass? I didn't hear anything, but I don't know whether you see some variants in the UMass or in our hospital.
There is, so far, there's been only a little bit of sequencing of virus. The way to define the variants is to actually look and trying to what we call sequencing, checking the exact sequence of all of the elements of the RNA. And the United States, several other countries are doing a better job of checking for that. Massachusetts is one of the areas which has done some sequencing. We're rapidly ramping it up right now. There actually has been 2 individuals in Worcester County who had the UK variant. And we've had none of the Brazilian or South African variants people have heard about have been so far been found in Massachusetts. They've been found in other parts of the United States. But we expect that there probably is real possibility that we'll have all 3 of those variants in Massachusetts at some point.
Unfortunately, yeah. And what are the age limits of these vaccines at this moment? I think it's 16 or 18.
16 for Pfizer and 18 and above for Moderna.
And there's no upper limit on the age limit.
I don't think so.
And there was a question, another question from Soud again for the effectiveness, which, as mentioned, when start in July, so we don't know how long the vaccine will be effective yet. But it's then let me see another question I can read from here. Immunity. Can you get the first shot Pfizer and next one from this? No, this has been answered. Mix and match is not allowed. And the immunocompromised patient population getting the vaccine. This is another concern I've received emails for. Is there any concern for immunocompromised patients getting vaccines? Do we have some guidelines for them?
No, it's actually at this point, there's not a risk, there's no harm to someone who's immunocompromised from getting the vaccine. These are not live vaccines at all. So there's no possibility of getting this. So it's not like the measles or mumps vaccines or the first shingles vaccine, the chickenpox vaccine, which is a live virus. But so these are killed vaccines. There's nothing live there. So there's no risk. The issue would be that they may not, if you're immunocompromised, you may not get a good antibody response. so that you may not get the same level of benefit from getting the vaccine, but there's no harm from getting it.
There no harm. There's a question about again vaccine for pregnant women. Fozia, can you just give us brief again? Somebody's asking question about the pregnancy.
So yeah, this is a very common question, and I answered in detail. Hopefully, you'll be able to listen to the recording, and you'll know the detailed answer. But at this time, Centers of Disease Control Prevention, CDC, American College of OBGYN, and Society for Maternal Fetal Medicine agree that the new mRNA COVID-19 vaccine should be offered to pregnant and breastfeeding individuals. The WHO recommends against using mRNA vaccines in pregnant women, and only because they were not included in the trial. But I had already explained that mRNA vaccines do not contain a live virus particles. The RNA really just degrades or eliminates from the body after hours or days. So the chances that it will cause any harm to the fetus or to the baby is very, very low. And the benefit the mother will get is she's going to produce the antibodies which can cross the placenta and actually save the baby.
There's a question for Dr. Castiel, as a public health commissioner. The question was from the email I got that the understanding is more than 90% of the people who get the COVID don't get the disease are mild symptoms. So, and there are potential unknowns from the again part of this same vaccine hesitancy. So the person asking if the 90% people don't get sick from the COVID, then why should I get the vaccine? Why should I?
So the main, yep. So the main reason to get the vaccine is to be able to get what we call herd immunity. And if everybody gets vaccinated and we get at least 80%, it keeps on increasing those numbers. But if we at least get 80 to 85% of people getting the vaccine, that means that the virus has no place to go after that, and we can eradicate the virus at least. It will also prevent getting more mutants, so mutations. So if we were able to do that, we would, that's what it will do. I don't know, Dr. Ellison, if you have more to add to that, or.
Well, I would simply add that of the 10% of people who do get sick, the illness can be very devastating. You do not want to be someone who spends 2 weeks in an intensive care unit. It is a very debilitating process, and for every physician I know, we ask them what their thoughts about getting care in an intensive care unit for COVID, they would gladly get the vaccine. It is the people who get sick have a frightening illness.
And I just want to add to that note is also the people who don't get to the ICU. I have seen people in my clinic with there is a phenomena which we are calling as long COVID or long haulers of COVID, and that's concerning because it's an illness with some persistent symptoms or development of even new symptoms later on. For example, I have a patient 6 months after their illness without return of their sense of taste or smell. So there are many benefits of getting vaccinated.
Very good. There's a question from Dr. Salman Malik that we know not to take prophylactic Tylenol or Motrin before. Any data that suggests it may not be a good idea to take these medications after getting the shot? Would it be a good idea to just minimize the intake after? So before and after NSAIDs and Tylenol.
So I think there was data on, it comes from hepatitis B vaccination, I believe, which has been seen in children and from the pediatric world, where they do not recommend preventive doses of Tylenol or NSAIDs. However, in the post period, like after getting the vaccine, it should be okay. It should not. I think the question is that will it not give me enough immunity if I take Tylenol or ibuprofen, or that should not be the case. In fact, we recommend people you can control your symptoms after the vaccination, like your local pain in the arm or fever. Like for a pregnant woman, you don't want want them to be with a very high grade fever because that would be harmful for the fetus. So it is okay to take acetaminophen or NSAIDs.
There's a question again about allergies. Mr. Tyre is asking that someone who has serious, serious peanut allergy, would it be risk after taking the vaccine and a follow-up? And then there's another question about why there's no booster vaccine for Johnson & Johnson.
So I'll answer the first question regarding the allergies to peanut. So food allergies, peanut, shrimps, I get asked this question a lot. CDC and even the manufacturers of the vaccines, they do not recommend, like, it's not a contraindication. You can still get vaccinated. The only contraindication to get the vaccine is like if after the first shot you get an anaphylactic reaction, or if you are allergic to the components of the vaccine, such as polyethylene glycol or polysorbitol.
Yeah, it is suggested if someone's they're concerned that they've had an anaphylactic reaction to pass the vaccine, that you get watched for 30 minutes after you get the vaccine as opposed to just for 15 minutes. Because when the anaphylactic reactions are seen, it's usually in that time period. And the answer about the question about the Johnson & Johnson, it's simply a question that they looked at the level of antibody was seen in the initial individuals getting the vaccine. They found that there was a very reasonably high level of vaccine with a single dose. And they then went on to their phase 3 study with a single dose, and it looked very effective. There is a follow-up study being done of looking at giving 2 doses of the Johnson & Johnson vaccine. And that may show that there's going to be a further benefit from doing that. But so there may be evolution of this, and there may be a change in recommendation 6 months from now. But right now, it certainly seems you're going to get a very good response for multiple months with a single dose of the Johnson & Johnson vaccine.
Okay. The question which I can answer from Safana, that how long do you have to wait after you get the COVID infection, which is roughly right now is 90 days. The other question is that what if one gets allergic reaction for the first dose? Will still be a second dose for those people?
That's being handled on a case-by-case basis. There have been a few people who've had very severe reaction. Someone has a very, very severe reaction, be likely to recommend not getting a second dose. Those are very, very rare reactions. But if that someone does have one of these rare reactions seen less than 1 in 10,000 people, they may want to hold off on a second dose.
And the same question on the same lines, which came from the email, that patient was diagnosed, and we have seen personally ourselves too, diagnosed with COVID after getting the first shot of vaccine because they have not developed the immunity yet. And then should I get their scheduled second shot after 3 weeks or 4 weeks, whatever the timings is?
So, so the recommendation by Infectious Disease Society of America for that is to wait at least 14 days after the symptoms have resolved, and then get the vaccine for the second shot.
Okay. And the question from Shabana Chaudhary is, why is taking so long to get results for rapid test? Right now, emergency rooms test all patients. Are we going to be able to test all our patients in our clinics? Is there any reliable kit out there that we can implement in private practice? I think it's more of a testing question. I don't know anyone who knows.
Well, there's a lot to talk about in terms of testing right now. There are several different kinds of tests which can be done. The PCR test, which has been done available, was very limited initially. It took a while to get done. That is the gold standard test that we're using right now. There are several companies manufacturing a PCR test which can look for the presence of the viral RNA, which have a turnaround time of about 2 hours. They're pretty expensive tests to have done, so it's a question of the cost of doing them. It is hoped that there will be able to do rapid tests for the presence of the viral protein, and it's anticipated, we call that an antigen test, and it's anticipated that several of them are going to be in the market in the next 4 or 5 months. They could potentially be very inexpensive. They would not be definitive in terms of saying someone doesn't have COVID, incubating COVID, but it would tell you probably in the next, at the time you're having the test, you're not infectious to others. So that would be a test. It's not as sensitive. It should be able to say that someone doesn't have COVID, which is risk of giving it to another person. And it's that kind of test might be able to be done. It's maybe cheap enough to do it multiple times a week. If that could be done to $3 a test, and someone could go to college or go to school and get tested, 4 days a week and find out safely. So that kind of test may be available in 5 or 6 months.
Okay. Thank you. And the question is for John. That John, if I wasn't a physician, from your understanding of the rollout in the Massachusetts, when do you think I will be getting vaccine? Like in April, May, June, July? When do you think? Any middle-aged person with no comorbidities, suppose?
Right. My answer here is certainly just an estimate and a guess. But, if I would say if you are under 65, if you don't have 2 comorbidities, if you're in the general population waiting for the general population rollout, that late May, June, July would likely be the time. But it all depends on how much vaccine we get. If we see, sorry for the pun, but a bolus of vaccine coming in that we didn't expect. Certainly that could be before. If there's a delay in manufacturing, then it could be a little later. But that's certainly where we see the targets based on where the phase rollout is.
Okay, good. Let me see. So this is a question which we asked before, but Mr. Tyre asking again. If you had a choice, which we don't, which of the vaccination you will opt for yourself? So,
I'm happy with the mRNA vaccine.
okay. Yeah, we have it. Yeah. Okay, so I think it's 7:43. If anybody has questions, please feel free to ask. I'm done with my question that I had in my. The panelists are here. We are more than happy to answer any questions from the audience. If not, then one last question: that when do you see this pandemic to be under control, so we all can go back to some sort of normalcy? I don't think it will completely come, but how we be able to walk outside without the fear of getting COVID? When do you think? Just one last point, estimate.
Well, I don't know. It's going to be. I think we're going to be facing it's until we actually get to herd immunity. I think it's going to be a while. And since we're not going to immunize everyone until April, May, or June, I think it's going to be the end of the summer, and then will become a question of how much we're seeing in terms of variants. And we do know that this is a similar virus to cold viruses, and they always come back every winter. So the next question will be what will happen next winter. We've been very fortunate to have had almost no flu this winter. So next year, we're going to have to worry that people have to worry about getting the flu or getting these other viruses like RSV that we doctors worry about in kids, or human metapneumovirus or other ones, and corona and this one virus circulating. So we'll be thinking about this. We'll be talking about this a lot next winter.
Dr. Castiel, do you think the booster will be in better shape in the next couple of months?
Yeah, our number of cases is already dropping, and the vaccine has been amazing. Yesterday was the first day since November we did not have a single hospital employee come down with COVID. We had in middle of December, we had 15 or 20 of our healthcare workers, nurses, and doctors getting sick every day, and having no one getting ill yesterday was really something to celebrate.
Thank you. Dr. Castiel, do you see the same scenario in the Worcester County? Cases are dropping?
Yes, I do. And our percent positivity has been slowly dropping. And I think the last testing that was done by UMass, on the mass testing site, the percentage dropped also. So we're seeing the numbers drop. So it's a good thing. And hopefully we can end this soon.
Okay. There's a question asking that, is there any chance that flu and COVID vaccine may be given as a one shot next year?
No.
To different animals, to different illnesses, unfortunately.
We're getting a combination vaccine. We have to go through the whole approval process, and it's not going to happen that fast.
Good. So, Dr. Castiel, any last comment you want to make for the audience?
That everybody should get vaccinated, that this is a huge deal for all of us, that this is, if we can end this, if we can get that herd immunity and we can get, everybody vaccinated, we'll be able to take off our masks at some point. We'll be able to hug each other. We'll be able to really protect our entire community. So if everyone can get vaccinated, that's the best that we can do. I greatly appreciate it.
Thank you. John, do you want to say anything last?
I will echo that. Don't be vaccine shopping. As soon as you can get the vaccine, please get the vaccine. Any vaccine is good vaccine.
Any vaccine, good vaccine. Absolutely. Dr. Qamar, do you want to say something and then do the closure for us?
Yeah, I mean, on the same lines, don't be afraid of side effects, be strong. They're not going to last forever. Maybe a day or two, and just go with the positive mindset that you're going to beat it.
Thank you. Thank you very much, one, for joining us today. It was amazing. It was impressive. We've recorded it so people can watch it again and again. If they have any questions, again, they can also reach out to me or Tahir Ali, email us, phone us. If they have questions, we can happy to connect you with the panelists. And as I mentioned, there are a lot of people who have concerns and hesitancy about the vaccines. We are here to address it, and we have received it, and we are more than happy to answer any concern people may have it. Thank you very much once again. Appreciate, and have a good night, everyone.
Thank you.
Thanks,
Thank
everyone.
you, everyone. Thank you.
Thank you. Bye-bye.
Once the pandemic is over, there's going to be a big party at my home.
There
Everybody's
we go.
We'll be there.
Yeah.
Thank you. See you. Thanks a lot.
Thank you. Bye-bye.
All the best. Thank you very much, everybody.